Okay, so good evening, everyone. Sorry for the short delay, and I hope you can all hear me. A warm welcome to our virtual panel discussion on sustainable healthcare in the aftermath of COVID-19. This is an event jointly hosted by the BMJ and the Faculty of Medical Leadership and Management. My name is Shivali Fulchand, and I'm a junior doctor, and I've taken a year out to work as an editorial registrar at the BMJ as part of the FMLM National Medical Directors Clinical Fellow Programme.
Good evening, my name is Laura Davis. I am a nuclear medicine trainee at University College London Hospital. During my time in this post, I've acted as the sustainability champion within the hospital, working alongside other healthcare workers to promote sustainable development within the trust, and I'm also a member of Doctors for Extinction Rebellion.
Throughout this year, a key focus of mine at the BMJ has been the impact of climate change on health and healthcare. I've had the opportunity to attend national and international climate events alongside writing and editing articles on the intersection between climate and health. It is an area that has always concerned me, but whilst in clinical practice, it is something I did not have enough time to think about, let alone act upon. This is, of course, probably a similar experience for other busy clinicians.
As clinicians, it can be quite overwhelming just thinking about the day-to-day aspects of the job, as well as planning for future exams and dealing with regular placement rotations. But what we have as a driving force behind our decision to practice medicine is the desire to help others, to improve the health and the lives of our patients. When thinking about how we achieve this, it's crucial that we think outside the walls of our clinics, that we think holistically and with a view to the future. The long-term health implications of climate change are all permeating. We can expect a rise in the incidence of so-called tropical diseases such as malaria in the Northern Hemisphere. More common diseases such as stroke and diabetes will also be adversely affected in the context of a rising temperature. And climate-induced mass migration will result in huge population shifts, which may overwhelm our already taxed health system. This final point may sound quite familiar. Only recently, we've all faced the need to restructure the way we deliver care in order to prevent the NHS being overwhelmed as a result of COVID-19.
And the same clinicians who will be treating patients affected by climate change are part of a system that is contributing to our high greenhouse gas emissions. The NHS contributes 4% of national emissions every year, which is remarkably similar to that of the airline industry. The good news is that overall, the UK has managed to reduce emissions by 30% between 2008 and 2019. However, the bad news is that we are still far from the target of net zero emissions by 2050. To achieve this, healthcare has a critical role to play. COVID-19 has shown the vulnerabilities of our health systems. Therefore, we need the collective engagement of all healthcare staff to ensure we are adequately prepared for future challenges, and arguably, climate change is one of the biggest. So this evening is about giving medics the opportunity to engage and ask questions to our expert panelists who have all worked on climate change and its effect on health in various ways. You can enter your questions for the panel and we will pass them on to them. We are fortunate to have Fiona Godley chairing our panel discussion this evening. Fiona Godley graduated from the University of Cambridge in 1985 and trained as a general physician. She joined as assistant editor of the BMJ in 1990 and was appointed editor-in-chief in 2005. She has led the journal from strength to strength since then and has been a strong advocate for doctors speaking up and acting on climate change from early in her tenure as editor-in-chief. Indeed, when the BMJ started publishing about climate change, readers would write in telling the journal to stick to their knitting. Of course, many years later, we understand climate change is an issue for all doctors. Therefore, we are delighted that Fiona has agreed to chair this event, and I will now hand over to her for the rest of the evening.
Thanks very much, Shivali, and thank you, Laura, and congratulations to you both on organising this very important session, and very delighted to be chairing it on behalf of the BMJ and FMLM. So yes, as Shivali just said, the climate emergency is something that the BMJ and all of those on this call have been working to try to highlight and try to consider how doctors in particular can take a lead and really see this as something that's part of their role. It's been a very interesting experience the last few months where this climate emergency has been overshadowed largely by the COVID pandemic, but seeing them as two things that are linked, both in terms of their underlying causation and also the way in which they show globalization as never before, and how countries across the world have all been affected, but the most vulnerable in all of our countries affected the most. And also potentially highlighting the way in which countries can cooperate internationally and how that may succeed or fail, and how much our own futures depend on the success of international cooperation. So I think at the international level, there's so many lessons to be learned, but also even at the local level, what can we do in the way we respond to climate change? What can we learn from the COVID pandemic that we can apply to our response to climate change, the climate emergency? So we have two themes for this webinar. The first is about how COVID has changed the thinking at system and government level. And the second is how it has changed thinking at the public and ground level. So we're really going to begin at the system and government level and then move more locally. And we've got a fantastic panel, all of whom are committed to acting on climate change, and many of whom have been doing so for a long time. So I'm just going to briefly introduce the panel, and then we'll move on to the first session. So first, Andy Haines, who's Professor of Environmental Change and Public Health at the London School of Hygiene and Tropical Medicine. Say hi, Andy. Then we've got Terry Kemple, who is the Royal College of GP's representative for sustainability, climate change and green issues. Is the lead for the college and the SOS, which I think means Secretary of State, Green Impact for Health Toolkit and Award, and is a former president of the college. We've got Robin Stott. Hi, Robin, who's chairman of the Climate and Health Council and of C3 Health, and has been a major player in the setting up of the UK Health Alliance on Climate Change, which involves many of the Royal Colleges, the BMA, the Lancet, and the BMJ. We've got Vishal Chauhan, who's an activist working with Doctors for Extinction Rebellion and is an emergency medicine doctor. Hi, Vishal. We've got Chantelle Rizan, who's a surgical research fellow at the Royal College of Surgeons of England and sustainable surgery fellow at the Centre for Sustainable Healthcare. Hello, Chantelle. And finally, we've got David Pension, who is Honorary Professor at the University of Exeter and former Director of the Sustainable Development Unit for the NHS. So that is our panel. And as Shivali and Laura have said, we hope very much you'll put some questions to them via the question putting system. And those will be fed into the debate later on. So moving on to the first theme for this webinar, which is, as I've said, the way in which COVID may have changed the system, the way in which the systems and governments behave, and whether it has radically shifted organisational and government responses, and in what way could we enact the same changes for the climate crisis, which seems to have been taking a rather slower route. So I'm going to first of all ask Andy Haines to start on this session. And really, one of the issues you might want to focus on, Andy, is about online conferences and reducing air travel, which is something that you've been advising for many years. And you and we thought it would take a great deal of time to implement. But the pandemic has achieved that in the blink of an eye. Do you think that this is really going to be a permanent shift, and what would you like to see happen in this area? Andy.
Well, thanks, Fee. Yes, I mean, you're quite right. We've seen very dramatic changes in behaviour over the last few months, and we have to capitalise on those really in order to try and embed change more in the system. So some of the changes we've been proposing, as you say, for many years have happened almost in the blink of an eye confronted by COVID. But I suppose the big question is, to what extent will that really change the way in which the whole economic system works? And I think there are some words of caution here, because as we look at the declines in CO2 emissions, greenhouse gas emissions, and NO2 and other air pollutants, which have occurred as a result of the lockdown from COVID, we can also see that they're bouncing back quite quickly in many parts of the world. And if you look at the economic stimulus packages, there's been a recent assessment of these. Only about 4% of the stimulus is actually going to reduce greenhouse gas emissions, and 4% could actually increase greenhouse gas emissions, and the remainder is probably fairly neutral. So at the moment, that potential is not really being fully realised in the post-COVID stimulus packages. So one of the challenges really is to integrate health, the environment, and the economy in a very cross-sectoral and integrated way in these stimulus packages. We know that economic recession itself has big adverse effects on health. You look at the 2008 recession, for example, that increased mortality rates in many countries, increased morbidity, increased the mortality from a range of conditions, including increasing mental health problems. So the danger is that the recession will add to the impact of COVID and have negative effects on health. And so what we need to do now, I think, is to craft a very positive message. You know, for years we've been saying to people, climate change is going to have negative and potentially catastrophic effects. And you can motivate people to change to some extent, but what we really need now is a vision of a world in which we want to live and how we get there, and the opportunities that are presented by rapid decarbonisation, not just in reducing the risk of dangerous climate change, but also improving health in the near term, for example, through reduced air pollution. So there's a lot to play for at the moment. We don't know exactly how things will evolve, but we do know that it's an unprecedented point in human history. We are seeing dramatic changes, and we must make the case for those changes to become really embedded in the system. And it's been very heartening, I think, to see in the last few weeks, for example, the representatives of 40 million health professionals writing to the heads of state of the G20 countries, urging them to put in place zero carbon policies as they emerge from COVID. And we've seen WHO's program as well, that the points that they've been making about the zero carbon economy, greater resilience, decarbonising the energy system, and of course the role of the health system itself. So we're seeing some encouraging responses, but we're not seeing the mainstream economic system shifting rapidly enough. And so that's why I think as health professionals, we need to work with people from different sectors, but make a very strong case for a recovery which is based on the triple wins, if you like, for health, for the environment, and a more equitable economy. I'll stop there. There's one more I could say, but I'll stop there.
Thank you very much, Andy. We'll come back round, but let me just turn to Terry Kemple then. I mean, given what Andy's just said, how can we make that case? You know, how could we learn from the way in which COVID has overtaken everything to really magnify our message so that case is properly made?
Thank you, Fiona. I mean, COVID has affected everyone. There's been a lot of learning, not least learning about what's important to each of us. One learning point that should be that our failure managing COVID will look like a sneeze compared to the failures managing climate change. COVID is really a simple short-term shock to human life. And all my working life, we've been expecting this pandemic. We've had plans prepared, but COVID has shown how quickly plans go wrong and business as usual becomes impossible. But it's also shown us how fast human behaviours can change. Climate change is a complex long-term global disaster, and we should already be mitigating to avoid the unmanageables and adapting to manage the unavoidables. But we're not. So we have to ask ourselves why we are so complacent. The first surge of COVID is over, and we all know the world has changed, but we don't know how. Have we been catapulted into a new era of enlightenment where our eyes are wide open and we can see we're on the edge of a precipice? Or are we going to look away and expect someone else to solve this problem? Sometimes story helps us to understand things better, so I'm going to give you a story. The long-awaited floods had finally come and the waters were rising. The stranded man in his home believed that God would save him from drowning. A stranger in a rowboat came by and warned him the flood will get worse and asked him to get into the boat. He said, "No thanks, God will save me." The water kept rising and he moved upstairs. A motorboat came and the people in it told him to get in. Again he said, "No thanks, God will save me." The waters kept rising. He climbed onto his roof. A helicopter flew by and the winchman shouted, "Get into the harness." But still he wouldn't, saying, "No thanks, God will save me." The flood waters kept rising and he drowned. When he got to heaven, he asked why God hadn't saved him from drowning when he had such great faith in God. And God smiled and said, "What more did you want? I sent you 2 boats and a helicopter." So for decades, we've heard the warnings about climate change, and mostly we've ignored them. So we have to ask ourselves, who do we think is going to save us? In addition, doctors have an extra ethical dilemma. Climate change is a major threat to public health. If we want people to stay healthy, and our planet has to be healthy, and we have to protect its complex natural systems. In January before COVID, I sent an article to the New Bioethics about climate change asking, are the doctors who take non-violent direct actions radical activists, right-minded professionals, or reluctant whistleblowers? Doctors have a duty as right-minded professionals and reluctant whistleblowers to raise public awareness and influence governments to do what's needed to protect public health. Taking non-violent direct action to raise awareness does not make them radical activists. We can't go back to business as usual. We must build back better. As President Kennedy said, if not us, who? If not now, when? So I'm asking everybody on this webinar tonight, what are you going to do differently in the future? Thank you.
Thank you very much, Terry. And I suppose the purpose of this discussion is to say, what can we learn from COVID to really decide what we're going to do differently, and what actions, if we take them, will really make that difference. So Robin, as someone who has been an activist from many years ago, as part of the International Physicians Against Nuclear War, and then very active in the climate change tackling community, what do you feel we have learned from COVID, and how do you feel we should be investing our resources differently so that we can really put climate change in its place?
Thank you, Fiona. Well, I view this problem through the perspective of the three systemic problems which erode planetary and human health. That is to say, the climate crisis, inequality, and the lack of voice that people have in actually interfacing with the government and enabling them to hear our voices. And to resolve these problems, humanity has got to work together to create more rather than less equal societies, evolve within the 9 planetary boundaries, and with lots of people involved in giving their point of view. And in thinking about this, I want to look at the COVID thing in the context of these 3 issues and see whether our response to these issues has changed through COVID. The first is the inequality. And does our response to COVID help us create a more equal society? Well, the epidemic has clearly shown who's essential and who isn't essential. And those that provide for our needs rather than our wants, and who are traditionally the poor and underpaid. And it's highly likely, it seems to me, that a wider populace will support governments in actually making sure that this group of people who are essential to the recovery to anything are in fact properly prioritized. But we have to be careful that healthcare, which has been such a prominent part of the response, doesn't get an over amount of the money, because the antecedents of healthcare are equally important. And I suggest on that we all as health professionals say that when £1 billion is put into healthcare, £2 billion should be put into the antecedents of healthcare, such as childcare, renewable energy, regenerative farming, and the like. The second is, will our response to COVID help us live within planetary boundaries? Well, it seems to me that the vibes are there's been a shift in the mindset of many people. Living with COVID has shown us the benefits of living with clean air, less noise, a greater reliance, anyway in Italy, on active transport, and a greater appreciation of the spiritually enhancing effect of reconnecting with nature. It's at least questioned our collective dedication to consumption and led to a vigorous discussion around the virtues of home and local hub working, video conferencing, electronic communications, reducing working hours, and a different life-home balance. As I think a shift in mindset is essential to us tackling the various crises we face, I think this is an important legacy of the coronavirus thing which we can build on. The third, will our response to the COVID crisis help a wider public, local government and business effectively to participate in solutions? Well, it's clear that devolved countries such as France and Germany have handled this crisis better, and that devolution and the involvement of a much wider public is an important step in actually trying to restore the balance we need. And it's also clear that decisive action by government confronted with a public health emergency leads them to do some really quite surprising things. And at least it's with a tacit consent of the public. So even neoliberal governments recognise and prioritise key workers and mobilise the £300 billion in this financial year, which makes the £100 billion that we need to implement the new Green Deal, which I think Terry was alluding to as the right way forward for us to get to a better world, really seem doable. So finally, can we find a much more compelling way of communicating the health consequences of the ecological crisis to provoke the necessary interaction between the populace and government to mobilise 100 billion and implement the new Green Deal. And I think for me, that means that we all have to engage much more effectively in both the political process and in non-violent direct action to achieve that end.
Thank you, Robin. And I should say that you have been arrested and spent a night in Wandsworth Prison. So I'd just like to doff my cap to that.
It wasn't particularly pleasant experience, Fiona, so thank you.
Thank you so much to the three of you. I'm now opening it up to the panel in general. I want to ask David, if I may, David Pension, about this question about why governments around the world have felt able to respond so radically to what Terry has called a simple short-term shock to human health. Well, it's apparently unable to respond to this much, much greater threat of climate change.
Yeah, thank you, Fiona. It's a great question, Terry. Part of the thing, I think, is down to human nature, in that we are programmed to fight or flight. We respond to sudden emergencies. So the temporal element is very, very important. In fact, as doctors and healthcare workers, we actually quite like emergencies. In fact, I think we're probably crisis junkies in many ways. We quite like the blue lights and the rescue part of it, which explains why a lot of people have got understandably very active through COVID. The issue with climate change is that it's happening at an incredibly dangerous rate. And by dangerous, I mean it's happening slow enough that we think we can adapt to it and learn from it and look forward to new technologies. But it's happening fast enough that it will actually kill us, because the triggers that we use in all our fight or flight, by the time things get very bad with climate change, we know the latency, things will be too late. Things will break down very, very badly. I mean, with a pandemic, at least if you got your game together, you can mobilize quickly, and there's a common enemy and people can see it and it's very obvious. With climate change, it's much more insidious. It goes deep to our economic systems, into our social systems. And I think because it's happening at this awful, awful rate, like a frog in a slowly boiling pan of water, I think, sadly, many people don't notice it. In fact, the science behind it is very interesting, because if it weren't for the science from Mauna Loa and elsewhere, we wouldn't actually necessarily know that climate change was going on, just in the same way as we as healthcare workers may not recognize that tobacco. It took us a long time to recognize that tobacco was killing half the people who used it. I just want to say a word for the research that underpins our knowledge and the actions which we should be taking. So in summary, Fiona, I think there's a very big difference that relates to human nature about a fast burn emergency and a slow burn emergency.
Thanks very much. Moving to Chantelle, I mean, your role is about sustainability, and how optimistic do you feel about the ability of, I suppose, the world in general, but more specifically the healthcare system to respond to climate change in a way that we could have learned from COVID?
Yes, I certainly think that we have seen from the COVID pandemic that we are able to be actually a really adaptive and responsive healthcare system. We are able to mobilise our workforce and see dramatic changes in the way in which we actually work as well. We've seen within COVID there's been a dramatic change in terms of the increased demand for healthcare, and certainly in terms of the way in which we've changed. We've got a deferred backlog of our medical case loads, and in order to help tackle that in the light of the current pandemic, we're going to need to have a greater emphasis on things like disease prevention and on actually helping our patients to better manage their conditions, and using some of those responses to treat our patients in the light of COVID. They're also equally applicable in light of climate change. So in climate change, we see an impact on our resources through climate adaptation and mitigation measures, and so I think they're just equally as applicable. Thanks very much. I mean, one of the issues I think is very interesting is long-term attempts to try and put obesity on the map, and suddenly, because we have this, COVID has
you know, highlighted the additional risks that people who have overweight or obesity issues. Suddenly the government saying, you know, everyone's got to slim down in the next 3 months to avoid a second wave. So I mean, that to me is a slightly ridiculous example of this urgency on top of an extremely slow burn problem. Chantelle, tell me your thoughts on that.
Yeah, it comes back to that point that we need to be fighting fit and ready for winter as such. And yes, I think certainly we do need to be putting ourselves in the best position, and that is about general public health measures. So doing those general things that we know in terms of increasing exercise and reducing our red and processed meat consumption, alongside alcohol cessation and smoking cessation as well. And of course, there are then those co-benefits that we see in reducing the environmental impacts of those individuals, whilst also improving their health and so that they're then better able to cope with these additional health burdens.
Very good, thanks very much. Vishal, as someone who's you know, active in Doctors for Extinction Rebellion, do you feel re-empowered by what's happened with COVID? I mean, it's distracted everyone's attention away, if you like, because we had quite a lot of emphasis on all of that before. Do you feel that we can rebuild the momentum?
Yeah, I definitely think we can. I think the one real positive that we've seen is that we don't actually need to rely on the government response to respond to crises. And in fact, if we do try and rely on the government to respond to crises, we'll be left 2 weeks down the line still waiting for them to figure out what to do. I was lucky enough to not be working in a clinical setting and dedicated myself to community mutual aid projects, initiatives, and just saw how rapidly people bandied together and started working together to respond to a crisis. Now, we have to stop thinking that we can stop climate change. It is going to continue to get worse, and we'll see the breakdown of politics, economics, and social fabrics. In that time, we will not have government leadership. We will only have communities. So the thing that I've seen, which has given me hope, is seeing that people can self-organize. They can come together without hierarchy and control. And in fact, people are starting to feel empowered. The sad thing is, in this moment when the whole population, well, not the whole, as you'll see from what I'm about to say, the majority of the population recommit themselves to health and well-being over all else, the government still fails to. They still choose to bail out industries that are systematically destroying the planet. And we just had an agricultural bill that's about to go through that is reducing food quality standards and environmental standards. And so still the government's not kind of acting in line, but maybe we need to shift our focus from government and system level to realizing that actually the grassroots, our patients, they are that system, and we can work with them more directly.
That's really interesting, Vishal. I welcome other comments on what Vishal's just said, is that, you know, has our focus, have we been relying too much on political action at the government level, and really should we address these issues much more broadly to the population at large, or to elements of it? What do people think? Feel free to raise a hand, or Robin.
I entirely agree with that, but I think that in the way that we communicate and articulate the problems of the climate and ecological emergency, we need to be much more responsive to the ways in which these community initiatives, which Vishal has been talking about, are evolving and developing. And we need to understand and learn from that to be able to articulate our views in a way which is much more resonant with theirs. Because I think I would depart company a bit with Vishal in the sense that I think that it is through the community activism that the government will finally respond. I don't think the response, and I think it's important for us to try to energize those community initiatives in a way which is true and real to what we believe, and formulating the health and well-being messages in a way which actually energize those communities seems to me to be an essential element of our way forward.
Thanks, Robin. Andy.
Well, I fully agree that, you know, communities play a very important role in changing the kind of trajectory of development, but I don't think we should let governments off the hook, because it's governments really which kind of frame a lot of the debates and also frame the incentives and the disincentives for change. So, for example, while we go on effectively subsidising the fossil fuel community economy, we won't be able to decarbonise rapidly. So pricing carbon is a very important element of any strategy to decarbonising the economy. And I think we need to increase the government's will to start pricing these things realistically so they actually reflect the true cost to society. At the moment, as I say, we're subsidising, in a sense, our own destruction, which is a foolish thing to do on a political level. And we shouldn't let governments get away with it. We also have to recognise that governments are not just national governments, they also act at the sub-national level. And indeed, some of the more far-sighted and dramatic and radical changes we're seeing are from city leaders, who have, by and large, been much more active than national leaders in terms of supporting a new direction for the economy, decarbonisation, sustainable living, and a much lower environmental footprint than we have at the moment. So let's not let the governments, both at sub-national and national level, off the hook, because whether we like it or not, they do frame the environment in which the private sector and the public sector operate.
Thanks, Andy. David, you're nodding. So
I just agree with all of that, and I think there's a balance between, well, in fact, I think Vishal and Robert and Andy summed it up nicely. There's a balance between what governments should do, and in democracies, poor though they are, they're the worst, they're the best of the worst. We should hold them to account. But I would support Vishal in his notion of, especially during COVID. COVID's been very interesting in those sort of the community strength that's come out. My worry about the fact that the community strength, people find the strength in communities during COVID, is the reversibility of that. One of the things that happened after the Second World War, almost the day after VE Day, is many people stopped talking to each other. And I think we ought to be very cautious that the community spirit that crises like COVID bring on, they're not there permanently. And when you get these sudden changes, these sudden trigger points, one of the roles of organized systems is to nail down the changes so we don't go backwards. And I think Andy's already talked about the emissions. And you know, we'll go crazy when we hear people talk about going back to normal, going back to the good old times. I think we've got to take every opportunity to almost literally nail down the good changes we see during crises like COVID.
Thanks, David. Terry.
Yeah, thanks. Because the agenda is so diverse and so huge, it's very easy for any individual to feel that it's just too difficult for one person to achieve anything. And I think we need to concentrate more on not expecting everybody to do everything, but to make sure that somebody is doing something. Then you have a mass movement, because we're all doing things, and some will take go a lot further at our level of influence. And I think because it's so big, we all feel that we can't do anything at all. And we have to change that so that we are empowered to do something.
Thanks very much. Chantelle, do you want to add to that about individual empowerment? Or?
Yeah, so I think certainly we do need to be empowering individuals to do what they feel comfortable to do themselves. I think people are often daunted by the scale of it, and it's easier just to ignore the problem, because as soon as you start to acknowledge some of those issues, then you need to start taking responsibility for those elements and making changes. And I think people often are scared to do the small things, and they're fearful that they'll actually be criticised and be called hypocritical for actually not taking on some of those other challenges, and feel that if they don't go the full hog, then actually what's the point? But I think that we all need to be just encouraging all those that we speak to do what they're able to, and if we can mobilise the great majority to actually take those small steps, and if we all go some way towards moving to a more sustainable society in future, then we will see that does mount up, and eventually we will get there.
Thanks a lot. I mean, I wonder then how optimistic we are, picking up the points that have been made about we mustn't let the government off the hook. We want to nail down these changes, and yet actually what one sees, you know, putting a sort of rather more pessimistic view, is that as soon as the restrictions that have been imposed around COVID are lifted, people do just revert back to their normal patterns of behaviour. And how it does seem to me, speaking, that unless there is that government action, that people find it very hard to respond in a more sort of sensible way. David?
Yeah, I mean, I think that's very important. One of the things that very often surprises me is when people say to me, "What can I do?" I often say, "Have you written to your MP?" People said, "No, never." And actually, of all the things that impress me about many politicians is that they're often very good listeners. And I mean, I think we all know that 13 letters to one MP gets referred to ministerial level. So numbers absolutely count there.
I didn't know that, David. Say it again, 13.
Well, it is a sort of rule of parliamentary lobbying that if MPs tend to get you know, one person's a crank, two people's a pressure group, three people's public opinion, that over 13 letters triggers, I need to write to the minister responsible. And that's not 13 letters from one person, I hasten to add. That's 13 letters.
We get those from the BMJ.
Yeah, so it does matter. And the other thing is, in terms of true participatory democracy, is offer to help. I mean, MPs are very overworked. So if you say, look, I was very taken by your speech on so-and-so, let me know, I would like to help you. And that's about finding your action. Like Chantelle was saying, find someone's entry point. If you find that if the MP is trying to do something and you think you can help, then for goodness sake help, because that will get you engaged, that will get you inside the room, and you're no good outside the room, really.
Thank you. Vishal, I was very struck by your point about what COVID has shown us is that people can act. I mean, there's obviously been things that have been imposed upon us, but actually what I've noticed, I'm sure others did, was that people were changing before government. They were ahead of government in the changes they made. You know, in some ways we've been feeling that government was a bit delayed. So do you feel, it sounds like you feel a degree of optimism that we can act. I mean, we're sort of saying we've got to have government as well, but we can act without them.
Yeah, optimism's a bit far. Yeah, I think that people have it in our nature to bandy together and work in small communities and respond to the issues that we face without the need for, you know, governmental dominion, if you like. And if we wait, it won't serve us. But one of the things I was just thinking about was how, yeah, I really appreciate, Andy, what you're saying. This isn't about letting the government off the hook with community organising. It's, and I think as David spoke about this like 6 years ago when I saw him speak, how do we make doctors true leaders? And you can't be a leader that helps to prioritise people's health and well-being by restricting yourself to the clinical setting. So the way in which we can keep pressure on, now that, you know, all of society's gone, oh yeah, we're going to prioritize health and well-being in the face of this crisis. And they've got all these mutual aid groups. So now what if doctors say, hi, I'm a doctor. Remember one of those heroes you were talking about before? Yeah. So now the hero's saying, I'm not actually worried about COVID. The thing I'm really worried is this other crisis, which doesn't have a peak. It's just going to get worse and worse and worse until it takes everything we ever hoped for our futures away from us. And now this is what I'd like you to do, or this is what we can do about it, and start normalizing resistance, rebellion, and advocating for real change. Otherwise, what we're relying on is another kind of top-down form of lobbying, which is to get organizers like are on this call to be lobbying in certain ways, rather than each of us as healthcare professionals really owning what it means to look at the determinants of ill health and campaign to stop them getting worse and possibly make things better.
Thank you so much. So let's talk about some barriers that might prevent doctors from feeling they can do that, because I absolutely agree with you. That's been the hope, that we would normalize, mainstream this and make it part of everyone's you know, remit. Why is that such a challenge, Terry? Why do you feel that doctors might find that difficult. I think the way you framed it there, Vishal, was really, really excellent. I'm not actually worried about COVID. You know, I'm sorry, I wrote any evidence of choice that was talking about Ebola and saying that it was, you know, the biggest thing was climate change. I've got a lot of backlash for that. People thought I was bonkers, and Ebola was the big thing. Terry, how do we empower?
Well, I think you have to ask your question: what stops people doing things rather than why they start? And certainly, you know, I've not always been active in the green movement. You know, for most of my career, I was just busy working, and that kept me pretty busy. And it's only, and then I didn't actually know what to do. And it's only when Bristol, where I live, became green capital of Europe back in 2014-15, and a number of us sort of popped our heads up, and you know, we all agreed we wanted to do something, but we didn't know what to do. And so that's when we came up with this Green Impact for Health Toolkit, which has got about 100 things that you can do. They're all pretty easy to do, one by one. There's a good reason for doing them, and we tell you how to do it. And gradually, bit by bit, it becomes part of your everyday agenda. And the great thing about all the sustainability stuff is that in the end, it saves you money and time and effort in the end, and creates teamwork. But I think the real problem is that most people, we have to make it easy for people. We have to make it so that they can do things. I mean, it comes from the top down and bottom up. I mean, you can use the example of face masks, this crazy situation we have at the moment, whereby, you know, we need both government legislation to advise people to wear face masks, but we also need peer group pressure, the people around us that are in the supermarket at the same time also wearing face masks, if we want everybody to wear face masks, whatever the evidence might be. And so it has to be top down and bottom up. So for both to be successful, we need both, and we're not really getting both at the moment. We're getting a bit of top down and a bit of bottom up, but we need both to be successful.
So we need bottom up, and I think, and there is evidence that bottom up can happen. Partly we need bottom up to make change, but also to put pressure on politicians so that they also make change from the top down. Maybe just before we open this up for questions from the listeners, what do we think would be the thing that would really make government change its mind? I mean, it's got its hands full. The UK government's got COVID still, second wave predicted. We've got Brexit. You know, what would put climate change at the top of the government's agenda? Andy, sorry.
Well, no, I think there are a number of things that will. I think what we have seen a bit of a frame shift actually in recent months, because we now see that there is strong public support in many countries, according to the most recent Ipsos-Mori poll. I think it was 18 countries, something of that order. Majority support for investments in decarbonisation in coming out of COVID. And I think that is beginning to change the political discourse, because we're seeing that the public is ahead of a lot of the politicians in this. We can also see it from our own Citizens' Assembly, which I think has been a very, very useful process. You know, if you present 50 randomly selected people with the arguments and the evidence, then they actually make very good suggestions. In fact, some of the suggestions are probably more radical than many of us as individuals would be generally prepared to make, because they can see very clearly the decisions that need to be taken. I think these kind of steps actually make it safer and easier for politicians to make the right decision. So I think emphasizing the importance of these kind of public consultation processes, the point of co-designing interventions and solutions, learning from case studies. So we desperately need to capture some of these local innovations that we've heard about from others. What impact are they having on the ground? What barriers are they experiencing, and how are they overcoming them? I think that can really motivate change to show how people are effecting, in some cases, quite transformative change at the local level. I think the other thing that's confronting the government is, how do we create an economy which is both health promoting but also provides employment? Because at the moment we've got large numbers of people furloughed, and we know that putting money into airlines or whatever is a very inefficient, it's bad for the environment, but it's also very inefficient in terms of creating jobs. We also know that renewable energy generates about 3 times as many jobs per dollar according to US data, but I'm sure it'll be the same here, as investments in fossil fuels. It creates a lot more employment in energy efficiency and renewables. So I think the whole barometer is beginning to swing, if you like, in our favour. We're getting a lot more strong arguments for change. And now the next step really is to embolden and to support the politicians in making those policy decisions. And of course, what we haven't said, what no one's said up to now, is the vested interest in the current system. There's a lot of people making an enormous amount of money in continuing to burn fossil fuels, and they are resisting change and indeed unsustainable food systems and so on. So we need to anticipate there's going to be a lot of pushback, and we need to develop more effective strategies at overcoming some of these vested interests, and we can maybe talk about that later. Yes,
very good. Robin, what do you feel that would really push the government to take this on with all its other...
Thank you, Fiona. I think there is a very good policy way forward which has already been formulated in terms of the new Green Deal. It has some defects and it needs some tweaking, and it needs, as Andy has said, and most of us are very supportive of, a deliberative trajectory with citizens' assemblies to analyse it. But it essentially has the framework for actually doing what all of us wish to do, which is to resolve the multiple crises we face in a way which makes us more resilient. And the new Green Deal has support across the political spectrum. Not much in the Conservative Party, it is true to say, but a little. And I think that one of the things that we can do as community groups and leaders is to say we would very much wish and encourage the leaders of the new Green Deal to get together and do some really good hard spade work in promoting it as a government policy. And it's a bit of a long shot, I know, but there are, as I say, roots in all the parties of people who might go along with this. And community pressure, which is essential, needs to be engaged in actually promoting the fact that getting the New Deal in place. But we do have, as I say, a policy framework which we can look at, which does tackle many of the things that Andy talks about: divestment from fossil fuel, a recognition of the barriers in place, and it also talks to many of the things that many of us want in terms of childcare, a decent agricultural policy, proper jobs in those that really matter. So there is a glimmer of hope there.
Thank you. Glimmer. David, you were going to say something.
Yeah, I just want to say before we open up to the listeners, the panel, more widely, this issue about what national governments can do. National governments make law, which we all have to obey, and in many ways we all hide behind. One of the things that is very interesting to learn from is how we got things on the statute book in this country that we never thought we would do. If you look at the history of getting banning smoking in enclosed public places, we never thought that would happen, and suddenly it happened. We need to go back to the story of how that happened. Health professionals were very, very clever and smart in the way we did that. So, and for instance, I mean, the Climate Change Act has been very, very useful, but it's not the whole thing. If you look at Wales, where there's the Wellbeing of Future Generations Act, that's a very, very important piece of legislation, and we don't have the equivalent in England. So getting that on the statute book, and the title is very, very clever. Who would vote against that? Who would vote against that? Just like who would vote against the Equal Rights Amendment? Who would vote against it? It's cleverly titled, and we need to use some of this knack, this cunningness, to get the public's wide sentiment that you see in Ipsos Mori onto the statute books. That then enables other things to happen, or disables the vested interests from carrying under and ablating their social license to operate. That's what needs ablating in terms of the vested interest, is their social license to operate needs to be pulled from underneath them.
Very good. And is someone looking to get the Wellbeing of Future Generations Act onto the statute books in England? Do we know?
There are, because Robin and I have been to meetings on it.
Okay.
I think that Wales and Hungary are the only two countries in the world that have it. But it's not just the act itself, it's the process by which public feeling is put onto the statute books and codified, or as Vishal would say, normalized. It's very important to normalize what we feel onto the statute books that nails things down and makes them difficult to go backwards.
Yeah, thank you. Shivali, I'm moving to you and to Laura to feed in any questions that people might have posed.
Yes, sure. Got a lot of questions. So the first one, the problem also is that as people with an interest in sustainable practice, we tend to preach to the converted. How do we engage people who are currently having this conversation?
Very good question. Thank you for that. Chantelle, what do you think? How do we engage people who are not already engaged?
Yes, I think we've, of course, over this last few years, 5 years perhaps, we have seen a great shift in public opinion, and certainly when I started out on this journey, it was really a question of sort of hitting your head against a brick wall, and people are, I think, a lot more open and receptive to these ideas that actually we should be taking responsibility for our environmental impact, and that's something to see in our personal lives. But I think we are beginning to see a transition to people actually wanting to take responsibility for their environmental impact in the workplace. And I think it is about trying to normalise those conversations, and they start just in the coffee rooms, in theatres for people like myself. And it's about really trying to call people out, and we are social creatures, and we don't want to be seen to be behind the curve. And if we feel like all of our peers and our colleagues are actually taking these issues more seriously, and I think when you're trying to then bring in change within a department, which does then have an environmental benefit, I think it is becoming increasingly hard to actually disagree with that standpoint. So I think we all need to be essentially starting to have those conversations, and whenever we make changes within a healthcare setting, we should be considering what we call the sustainable value equation, where we actually balance those patient and population outcomes against the triple bottom line. So that's the environmental, social and financial elements of sustainability. And if we can start normalizing that and start getting people to actually consider those whenever they do QI projects or audits or research projects, then we really will start to make this just something that is part of our normal dialogues within healthcare.
Brilliant, thanks, Chantelle. Vishal, what do you think?
Yeah, it's tough. It's really tough. I think you can't address climate change from within the clinical setting, or solely from within the clinical setting. So I would suggest that everybody reads the Declaration of Geneva again, then read Uninhabitable Earth by David Foster Wallace. Then you'll be in a good position to quit your job or work part-time, and then embed yourself in your local community. And then really we just need networks that are not within our own echo chambers, who still look to us as, you know, with respect, and go, oh, I'm going to listen to what a doctor's saying about this issue or that issue, and really feel empowered to push people in the direction of not just sustainable lifestyles, but political advocacy and activism. It's really difficult. It's really difficult. The only way to get ourselves into these circles is to put ourselves there. And with a full-time job, you're simply not going to be able to. And very soon we'll see the healthcare system, which is already at capacity, overwhelmed by another crisis. And we're really lucky this time, right? We're really lucky because everyone was scared to go into hospital. You know, I went back to work and I was told, we don't actually need you because there's more doctors than patients. So we were lucky. But what about the next crisis where people aren't scared to go in? Actually, they come flooding in. You know, anyway.
Can I just ask you, Vishal? So what you seem to be saying, you know, read Uninhabitable Earth, quit your job, become an activist. But isn't that going to be more preaching to the converted? What we need surely is people like you in the mainstream, not quitting their jobs, talking to the people who still remain to be converted.
Yeah, I am in the mainstream. Yeah, I'm in the mainstream. It's just I can't speak to what ultimately I want to be able to do is at the end of my consultation with the patient, at the end of ideas, concerns and expectations, I want to ask them, by the way, I'm not actually worried about this disease. What I'm worried about is how climate breakdown is going to mean that your kids aren't going to be coming to me with diabetes. They're going to be coming to me with malnutrition. That's what I'm worried about. So what are you going to do about that? But obviously I can't do that in a clinical setting, but I can do that outside of a clinical setting.
Yeah. Okay.
So as I embed myself in local community projects and other organizations, for example, I'm now organizing Black Lives Matter, I can now introduce that conversation with a whole demographic that is not normally paying attention to this issue.
Very good. Thank you for that. Other responses to this question? Otherwise, we can get another question. David, yeah.
Yeah, I think Vishal made a really interesting point about how you engage patients. And this is something that I think Terry gave a lot of thought to in the RCGP. And I used to find it quite easy in the clinical consultation to say, have you thought about stopping smoking or cutting down, or have you thought about changing your diet? I find it really difficult to say about climate change. But actually, one of the things that one can do, you've got to be clever about this. And I think that the RCGP have thought about, things like putting notices in waiting rooms where you get a large number of public eyeballs. I mean, the NHS sees 1 million people every 36 hours by saying, we have solar panels on this hospital, Chantelle, we have solar panels on this hospital in Brighton to save money and to save the future. And I think that subtle messaging, I wouldn't be as brave as Vishal in a clinical setting, but I think the NHS has plenty of opportunities to visibly show that climate change is a health emergency without risk being, I'm always paranoid about seeing as a hectoring professional, and I'm probably too timid about it. But I think the NHS has got a lot of opportunities. Having farmers markets outside the front door of hospitals is a really great idea. It's a really important idea. We've got bags of estate, we've got bags of roof space. We can do a lot of things. We should be a net producer of renewable energy, absolutely, with the NHS. We shouldn't be consuming electricity and energy in the NHS. We should be exporting it from our estate.
Thanks, David. Andy.
Well, I fully agree that health professionals have a very important kind of leadership role, and although one has to avoid kind of preaching in the clinical situation, there's often a win-win situation in as much as the kind of behaviour change we want people to undertake for their health reasons are also good for the environment. Diet, physical exercise, reducing air pollution as much as possible are all examples of that. But I also think we've got to be quite careful about equating health with medicine. And in fact, there's a whole range of other professions that we need to be engaging and showing them that they are probably as important for health in many ways as we are. So if you're an urban planner or a transport specialist or someone working in the food and agriculture sector, you can, or housing, you can have very big impacts on health and sustainability. So I would like to see the health professions reaching out to other professions that can actually influence the determinants of health, and in a collaborative way, working together to synergize between us a slightly broader vision of health, in which, in a sense, everyone is welcome and everyone has something to contribute. And I think if we can do that, we can really use that reframing of environmental catastrophe as a health threat, not just an environmental threat, but also as an opportunity. Then I think we can have a much bigger impact and get a multiplier effect. But I think it does mean reaching out beyond our professional silos to engage a number of other professions and occupations that have big influences on the determinants of health and determinants of environmental degradation.
Thanks, Andy. Terry.
So in clinical conversations with patients, actually, it's a lot easier than you think. I mean, in general practice, I think we've all been through this thing where you hear somebody else use a phrase or a slogan or a catchy phrase, which is just like perfect, and then you adopt it and use it for the rest of your life. Well, certainly in any clinical conversation with any patient, you can challenge yourself to try and work into it at some point, the little phrase, it's good for you and it's good for the planet. Now, you can do that with virtually every single consultation. If they've driven there, you can say, why don't you walk? It's good for you, it's good for you. Why don't you stop smoking? It's just dead easy. But you need the right phrase. So try using it's good for you and it's good for the planet.
Very good. Not so good if you're prescribing an antibiotic or beta blocker, but I suppose you could try it. But I take the point. It's very good to remember that. Chantelle.
Yes, I would say that an excellent use of that would be, so within my ENT clinic, when I see a patient with unilateral tinnitus, I would have to request an internal auditory meatus MRI just to rule out a rare an acoustic neuroma. It's negative the vast majority of the time. It's only about 1 in 170 times that it will be positive. And the vast majority of the time, those patients are then called back into clinic to actually just be told that it's a negative result. But I will always have those conversations with the patients, say, if it's negative, I'm expecting it to be negative, would you be me to write you with those results? And using that phrase, I think it's good for you, it's good for the planet. It is absolutely right. And we do often see that when we're actually making healthcare systems leaner, and we're actually there's also the fact that we're making it greener as well. So when we're looking at those absolute reductions in the number of resources that we're using, there are the monetary savings alongside the carbon savings, and there are also those social benefits as well when we think about the whole triple bottom line. So by not calling that patient back into clinic, it's reducing their travel and the emissions associated with that. But that also has a knock-on impact in the disruption to their work, their family lives. So there's often a whole range of benefits that we see in these simple changes in the way in which we actually deliver our healthcare to our patients.
Brilliant, thanks, Chantelle. Shivali, sorry, we've spent it was a good question. We spent time on it. Another question you'd like to share?
Sure. So we have lots of questions. We don't have names for everyone, but I can see we have the chair of the FMLM, Myra Lakani, with us, so welcome to him. We have a question from him and a couple of others on how COVID-19 has led to more virtual work, which is reducing our carbon footprint. Will this change be sustained, and how do we keep it that way and incentivize our leaders to do so? And what will this mean for our patients?
Great. Well, thanks. I'm going to come back to Chantelle there. Virtual work, is it going to carry on? I mean, the surgery, not so easy to do virtually.
Yeah, so I think certainly a few months ago there was such resistance to virtual working, and whenever we try and make any change within the NHS, as I'm sure that we all know, it's very difficult and it's cumbersome. And what we have seen over the last few months is that actually we are able to make do with existing systems, and we are very adaptive as human beings, of course, and we have found ways around, and there's been obviously a widespread adoption of virtual clinics, whether they are telephone consultations or video. And of course, there will be a subset of those appointments where it's important that we do have that physical contact as part of the examination process, but there will be a large number of our consultations for which actually the virtual clinics are entirely appropriate. And I think that now that we have got used to some of those systems, they will be used on an ongoing basis. And for the first time, really, we've seen doctors be able to do clinics from home, and that's a fundamental shift in the way in which we actually practice medicine. And perhaps we will see some of that on an ongoing basis as well.
Thanks, Chantelle. Terry, I mean, general practice has been a case in point, hasn't it? I mean, I think that's become managed pretty well virtually. Or what do you feel?
Well, I'm not active in ordinary general practice. I have been working for the NHS COVID 111 system during the pandemic. People are talking about hybrid systems now, really. It's really doing the right thing at the right time. So some people will need to be seen face to face, but whether because they're not tech savvy or because they need to be actually physically examined. Some people will, are perfectly happy with the video consultations and things like that. It's really important to get it right. I will just say that from the business side of general practice, if you take out all of the clinical stuff and just look at general practice as a business, then something like 55 to 60% of the carbon footprint of general practice is down to travel, patient travel and staff travel. So if we can reduce travel, that will have a big impact on general practice carbon footprint. If you look at general practice overall, then something like 65% of its carbon footprint is associated with prescribing. from the manufacture, the actual dispensing, and then the disposal of things associated with prescribing. So these are all things that we need to address, and we will have to address. But regarding the uptake of IT, well, I think general practice has always been ahead of hospital care in IT, but obviously this has just accelerated everything, and people are, you know, very happy not being stuck in traffic.
Thanks, Terry. I mean, David, you mentioned nailing down the changes. Is this a change that we can nail down?
Well, it's a good example. I mean, it's very interesting listening to Terry and Chantelle about the behavioural aspects of it. You've got to think about the financial aspects of it as well. And we always think about the disincentives for moving to a more sustainable system outside the health system, but there are plenty of disincentives inside the health system too. And I'm a bit out of date now, but I think tariff, I know some of Chantelle's colleagues have had quite a problem with hospitals saying, actually, if we really move much more to virtual outpatient clinics, in fact, there are some systems in the world that just don't do outpatients really, but if we move to that, you've got to think about the financial consequences. And so someone's got to address what the tariff is for a virtual consultation against a real consultation, because it may not seem very much difference, but those little niggling incentives, what they do is they crop up as excuses for, yes, we'd like to do this, but it's going to be too difficult, too costly, too inconvenient. But if you get the evidence about clinicians like it, patients like it, all the co-benefits that Chantelle was talking about, you're onto a winner. But you have got to nail down all these, not just real barriers, but perceived barriers. Perceived barriers are just as strong as stopping action as real barriers are.
Thanks, David. We're going to move on to our second theme, but obviously, Shivali, if there are questions that can come through, the two themes are very closely related. The second theme is about changing behaviours and thinking at the public and the ground level, rather than systems and governments. And one of the issues it could touch upon is the social shifts and the emotions that that might be needed to be engaged if we're really going to tackle climate change. And we've seen those emotions and social shifts really, you know, in a major way with the pandemic, and also with the Black Lives Matter protests. When a small immediate thing, we'll call it small tragic death in public of George Floyd in the States has led to this amazing and important and long overdue, you might argue, outburst of emotion, and potentially, hopefully, will lead to a lot of social change. So the question is, what can we do in relation to those things for climate change? You know, the response to climate change has not necessarily been as passionate and emotional and effective as it might have been. And how can health professionals help to gather that energy, and what practical steps can they take? So Vishal, can I just start with you on that? You know, obviously with your involvement in Extinction Rebellion, that's really what it seems to me, you're largely doing, is trying to engage that very same emotional and societal response.
Yeah. I think David touched on it a bit earlier. People aren't terrified, and so people aren't acting. And a lot of the things we've spoken about are like, yeah, having farmers markets in front, like speaking, dropping it in subtly, but we need to show that we're terrified, that we're deeply, deeply terrified, and this just isn't enough. And so in Extinction Rebellion, we try to work at that emotional level. But further to that, one thing that we have to really, really recognize is that the threats of environmental breakdown aren't just resource-based, aren't just based on, you know, us not having enough food or having enough materials toward housing and floods coming and thunderstorms and whatnot. It's that social breakdown follows material scarcity. And when there's fear, some people turn towards love and freedom. A lot of people turn towards tribalism, building up barriers and separations between our communities. And we are so fortunate to have had the rise of Black Lives Matter activism at this time, because it needs to go alongside the positives of the COVID work. because what we're seeing is people realizing, the divide and rule tactics that were used in that enslaved people from Africa and ruled the people of my heritage, which is India. That divide and rule tactic, the echoes of it are still with us, and they are far from rooted out from our psyche, and therefore we don't know what we will become as a society as climate breaks down. There is no governmental process, there's no top-down approach to rooting out deeply rooted separation and disconnection. There's only community, there's only speaking to your neighbors, there's only trying to connect with each other at a human level. There's nothing that Facebook can teach you, there's nothing that the BBC can teach you. We all have to take on that journey to step outside our door and look at the youths on the estate around the corner and smile at them and say hi to them and believe that they have every potential and their dreams are just as valid as your dreams or the people that you surround yourself with. And when we look at our family photos at weddings and we look at them and we go, there are no black people, there are no Indian people. Oh, it must just be because, well, what? Maybe we all have this unconscious bias and we need to recognize that and root it out, because right now we have an opportunity to do it, but soon, I don't know, I'm pretty frightened, to be honest with you. So we do need to work at this level and not just at the top-down level.
And mobilize that terror rather than paralyze people with it, that's, I guess, is a important
Well,
thing.
that's a difficult thing. I think that's why we're scared to talk about climate change in the healthcare setting, right? Why we're not willing to say, look, smoking's going to kill you, you're going to get lung cancer, you're probably going to die. We're willing to say that kind of thing. We're not willing to go, oh, by the way, I'm really worried about the climate crisis, or really convey our fear because we're worried it's going to paralyze people. So we need to find appropriate ways to do that. So where is that appropriate time? And I think there is like a case for doctors starting to get hysterical about this. I mean, that's why so many doctors have gone and got arrested. That's our way of demonstrating our hysteria around this issue and saying that we're taking it deadly serious, that we're willing to sacrifice or compromise our profession and our status in society. And so we need other ways to kind of demonstrate it, or use that one. It seems to be working.
Thanks, Vishal. David, what's your view on this?
Well, I think Vishal has raised some really important points. I think a lot of us, all of us probably, and certainly people who haven't been immersed in this area for a long time, will say, what is it you want me to do? What is it I should do? And unless people like us have got good responses to that questions, we're wasting our time. So this issue about looking at the evidence of behavioral change and getting the right balance between terrifying people, activating people, and inspiring them is really important. And my understanding of it is, I'm very happy to be corrected, but my understanding is that you have got to raise concern. You have got to say things are really, really bad. Now, Chris Rackley at UCL is very good at this, raises concern that we're going to hell in a handcart, but there are some great things we can do if we do them now at scale and pace. And what I'm really trying to say is the evidence suggests that you do need to really alert people, but you need to rescue them very, very quickly. You need to rescue them with positive, practical, doable things that relate to them and what they care about. Now, as Vishal has said, that is an incredibly difficult call to make. That's an incredibly contextual conversation to have. So it calls upon us all to be very, very good listeners, to look at people, to listen to people, their body language about what they care about and what we care about. And it's very tempting in a situation like this to say, here are 5 things you can do about climate change. But actually, those 5 things are very unlikely to be practical and relevant to everybody you speak to. What's probably much more important is to listen to people and help them work out what they care about. Because when you work out what you care about, whether it's biodiversity or ethical supply chains or saving rare mammals, that sort of, once you've keyed onto that, and we've discovered this all in our lives, once you understand what you care about, it's so easy to get arrested. It's no problem. it's very difficult to take radical action about things you're not quite sure you care about. Once you find out what you care about, it's easy. Now, that's the first part of the trick, is working out what, and we should all do that ourselves, because we often don't discover it till later in life. The other thing is then to work out what you're going to do about it, and make sure you don't get competitive. Because one of the worst things to say is, look, I'm not interested in obesity, I'm interested in diet. How many times have I heard such crazy things go on about, you know, I'm not interested, it's not about soil health, it's about carbon emissions. So we need to be very, very open and realize, I mean, Chantelle's got a colleague who's worked almost entirely his life on looking with the BMA about ethical supply chains. That is fantastic, to find your niche and to say, I'm going to focus on that. But I realize it's not the whole game. I realize there are lots of other things going on, and I'm very happy to interact with all those other lines of action. But someone said it beautifully earlier on this webinar, that find what your calling is, find out what your influence is, find out what your passion is, and then respect the actions of others who don't share it, so that you get a joined up systemic approach to helping us, you know, create a legacy we can be proud of.
Thanks, David. Chantelle, tell us more about that, and in particular about how surgeons are, you know, becoming active, and how you inspire that emotional but non-paralyzing terror in surgeons.
Yeah, so personally, I feel that actually, contrary to what we've heard, emotion is actually only going to get us so far. And I think that what we really need is to develop our strong evidence basis and our research that actually then guides our strategy, so that we ensure that our actions are then targeted at those major hotspots. And actually what we need to do is we need to do those full carbon footprint analysis and life cycle analysis to provide the evidence, because it's not always the case that the what we suspect to be the environmentally preferable option is actually the case, and there's often a lot of surprises. I would say this: I'm doing a PhD, and I'm using carbon footprinting life cycle assessment methods to actually identify the main environmental impacts within the operating theatre, and I'm then using that to actually provide an evidence basis to guide where we can make those biggest changes. But I think this is going to be a major challenge in actually reaching net zero is the availability of evidence, and we need to reach out to our research funders and call for further grant support in this field. And I think another really important thing is that whenever we're presenting this evidence, it should be alongside the financial savings. It is the language that we use within the healthcare setting. And I think that we need everything. We need the sort of emotional elements, but it needs to be found in the research. And I've developed these principles of sustainable practice, just share with you now, and they are on the basis of our evidence that we have available to us. And within this, I really would emphasise that our healthcare and surgical disease prevention, it does need to be prioritised. We then need to think about actually our patient education and ensuring that we actually empower our patients so that they do everything that they can do within their control to actually optimise their own conditions as part of their preoperative optimisation. And we're going to have a much greater impact through those things at the top of the hierarchy, as opposed to thinking about things like waste. So waste is actually just 0.1% of the carbon footprint of the NHS, according to the SDU reports. So we're going to, we shouldn't be focusing on waste and on recycling and that sort of thing. But when we really do need those operations, or we need surgical services, we need to think about those lean service deliveries and minimising consumables. So everything so far has been thinking about reductions, but at that point, we can then think about low carbon alternatives, thinking about low carbon treatment options, as well as using reusables where possible. And then we need to apply those circular economy principles to really extend the lifespan of our capital goods and our equipment through maintenance, repair and recycling. And certainly within my own research, I show that there's very simple switches that we can make, which don't have any impact on the care to our patients. So if we think about a surgical set, they need to be sterilised, they need to be housed in a sterile barrier system. The carbon footprint of a reusable aluminium aspect tray is just a quarter that of the single-use tray wraps. So that's a really simple switch that we can make. And actually, when I look at the data, looking at the consumables that we're using within our common operations, there's often just a few large, bulky, single-use plastic items which are responsible for a great majority of the emissions. So even though we're using reusable sets, there are a few single-use items that actually are responsible for up to a third of the carbon footprint of the consumables within that operation. So I would emphasise that emotions will test so far, and that they might open some doors to some people, but actually we need to develop that evidence basis so that we know where do we need to be targeting our efforts and how are we actually going to make those net reductions in our emissions to the planet.
Thanks a lot, Chantelle. One of the phrases that's come up is this idea of reimagining healthcare, and what would that look like? And part of this is looking back again at the COVID learnings that healthcare has changed so radically in the last few months, and what would a reimagined healthcare system look like that really lived and breathed the terror that Vishal's talking about, you know, that we really made clear to all of our patients and all of the members of the general public that the health system was taking this as seriously as it needs to be taken. Terry, what do you think that reimagined healthcare could look like?
So certainly in general practice, I think that there's huge opportunities, because the point about general practice is that we're a focus in a community, and we're role models all around us all the time. And you know, you don't have to be long in any general practice to realise how the health choices that we all make or are forced to make regarding driving, things like that, can be influenced quite easily if you have the right role models around you. So I think, you know, what we need is a network of change agents in every general practice and in every hospital who are actually just in the room pointing out to people, do we really want to do that? Are we aware of the consequences? In my own medical career, we at RCGP, we started introducing patients into some of our committee rooms early on, and it just changed the whole way people looked at things. And I think, you know, whenever we're doing things, one of the things we're trying to change at the RCGP at the moment is to add an impact factor about climate change and sustainability. So in addition to thinking about equality and diversity, when we make a choice about anything, we have to say, well, what is the impact on sustainability and climate change, just so that we're aware of it. And I think just asking the question makes people change. But, you know, we do need change agents everywhere so that people can't get away with just doing things business as usual. I mean, it will be business as usual unless something changes. So we need a change agent.
One of the things that I was, you know, rather shocked about is how public health has become so well fragmented and decimated over the last 10, 20 years, and how we have lost in the UK the strong public health leadership. I mean, Robin, you were one of those strong public health leaders. I mean, you still are, but I mean, in your professional capacity then, Andy's talked about the importance of the social determinants and the wider connections across town planning and every possible aspect of people's lives that contribute to their health. What do you feel about a reimagined public health system?
Well, I think it's really interesting that you said, Fiona, that we should reimagine healthcare. I think we should reimagine health. And one of the key issues is that actually we so often, as Andy said, and as I tried to say too, associate the two things, and we need to disassociate them. And I think that means, to go back to what Vishal was saying, that we have to communicate much more widely. You know that I've been obsessed nearly for many years now to try and understand how on earth we can actually interpret what we understand as health in a way which is consonant with the understandings of the RSPB, the Women's Institutes, the trades union movement, the Black Lives Care movement. And I think we have to find some way of articulating health in a way which is understood in its broader context, not only by healthcare and health professionals, but by the much wider community. And that's what I would like to see in this reimagining process, that we find some way. And in practical terms, as I think I said in my introductory statements, I think we've got to be very careful to understand that when we reinvest in health care, we equally say we have to reinvest in the antecedents or determinants of health. And in practical terms, as I said, I think we should insist, when a government says we're going to insist in health care, that they put double in the determinants to try and make it absolutely real. So my reimagining is extend the concept, try and find a way of engaging a much wider constituency in helping us reimagine it, and in practical terms, making sure the money flows the right way.
Thanks, Robin. Vishal.
I was just emphatically agreeing.
Okay.
I think for me, but I do have a point. Yeah, for me, it's we need to keep people out of hospital and stop thinking that clinical setting is going to make people healthy. It just stops them getting more unwell, and we are just so unevolved as a society in terms of creating thriving human experiences of life that are really warrant what we're capable of, what we really warrants our potential as a species. And I think we need to stop thinking about preventative healthcare. Like preventative medicine is just the wrong way round. You know, we're trying to stop people getting ill. What are we doing to increase people's experience of life? And I think, you know, I left working in A&E partly because I just couldn't deal with having to meet one person every single day who had attempted to take their life by means of suicide. And I was like, this is the wrong place for me to be. I need to be in another position where I can make sure that people have purpose, meaning, and a function in society. And this is so perfect because one thing that we need people that are running community gardens, people that are producing food locally, people that are connecting to nature, people that are running upcycling projects and schemes, local exercise classes, you know, whatever it is. Social prescribing is really ideal, but we need money to be going into community projects that keep people active and happy. And then people will start to love it. Once we put enough money in, and you know, you just need what is it 17% of people or something like that to get on board with this kind of idea, and then suddenly it will just be the norm in our society. And we'll suddenly notice, oh, people aren't coming to the GP practice because they're lonely. People aren't coming into hospital begging, pleading to stay alive for a bit longer so they can watch Jeremy Kyle and see one person to give them a Meals on Wheels each day and take them to the toilet. You know, they'll be like, actually, you know what? I had a pretty good life. You know, I think we need a real consciousness shift in our approach to health and not just stopping and curing disease.
That's so brilliantly articulated, Vishal. I should just say I've just received a copy of Nigel Crisp's book, which I'm now giving a plug for. Health is made at home. Hospitals are for repairs. Building a healthy and health-creating society. So, you know, I think there's a thinking around that, isn't there? Andy, just to ask you, I'm just momentarily forgetting his name. The man who talks about biodiversity, Eric
Chivian.
Eric Chivian talks a lot about this as well, about health creation. But what's your feeling about a redesigned? Andy's gone to get a book.
Well, I'm just going to get his book. I haven't had it right with me. Sustaining Life. It's a marvellous book. I haven't actually read it.
Your book is bigger than my book, Andy.
And I sort of touch it from time to time and look at the beautiful pictures.
Just show us the front cover again. Just show us the front cover again.
Oh, sorry.
Sorry, just show us the front. Show us the front cover again. Sustaining Life.
Absolutely beautifully produced book called Sustaining Life. And I mean, what Eric says is that, you know, we need the richness and biodiversity of natural systems to sustain health. And he points out the whole range of mechanisms by which those kind of natural systems underpin health, whether it be as a source of medicines, whether it be, you know, purifying the air, reducing air pollution, whether it be filtering water to make water cleaner, and so on. So a range of different, if you like, ecosystem functions which natural systems fulfill in order to sustain our civilization. But he does it in the most beautiful, visually captivating way, which I think is a real skill. So I do think we need to make this case that these underpinning natural systems they're not a luxury. They're not something for green people or for environmentalists. They're actually underpinning the whole health of our civilization. If we destroy our climate system, or if we destroy fresh water, or the biodiversity of our localities, then we're actually going to affect health sooner and later, probably. So that's an important message, I think. And what's one of the issues, I think, in our medical education system, we also had a very narrow framing of health. When I was a medical student, we never taught anything about nutrition or about the environment. It took me much later in my career to realize how absolutely crucial these issues are. So I do think there's a great opportunity now to reframe this and to reframe medical education. I also think there's a great deal we can learn internationally. We should be more humble and learn from other countries as well. I'm working with a group of people in Western Kenya at the moment. So I was asked to by a student of ours who's a very brilliant young person, who's a pediatric surgeon who's now becoming a public health professional, and she's Kenyan. So she asked me to engage with her group of colleagues in Western Kenya. And what's really interesting, this is COVID. So COVID is coming at them very quickly. They have very few resources. So what can we do? They do have a network of community health workers. And those community health workers, within a few weeks, they visited 10,000 households, providing basic information about hand washing, masks, social distancing, even giving them pulse oximeters. So when people do get ill, they can actually do simple measurements in the home. So I'm not saying this is going to necessarily solve all the problems of COVID-19, but it does show you that even in very resource deprived environments, you can have very creative and very positive responses. And I think we need to learn from the diversity of different responses around the world as to how we might tackle some of these interrelated problems now. It's not always a matter of just having more and more resources. Sometimes it's a matter of actually using them much more sensibly. And when I was in primary care, in inner city primary care, I often wished I'd had the great community health workers that I've met around the world. For instance, in Brazil, where every family has a community health worker, and they go and assess them every month or so. I often wish I had those kind of people to work with me in inner city primary care, because I felt, as we've already heard with others, I was just dealing with the symptoms and not really with the causes. And it's the people who know the community intimately that can actually kind of at least have some entry point into the causes. And maybe we need to integrate primary care, primary health care with primary environmental care, because increasingly we need to be looking at the kind of underpinning of the environment, how that relates to our health. So I think that would be an interesting challenge to do, and learn from other cultures as to how we might be more effective at doing it.
Very interesting. I'm noting a sort of trend here, with Vishal moving out of active clinical practice into this sort of more public health oriented, if you like. I mean, Harry Burns was the CMO of Scotland, you'll know, and was a surgeon and became he had the same response as you, Vishal, saying, I can do much more in public health. And Andy, I suppose you've had a similar trip from primary care into public health. Chantelle, no doubt, will move from surgery into public health before too long, unless we can stop her. I guess the question that springs from this is the point about medical education and how much we can instill a public health ethos or competence within every doctor, that every doctor should be a public health doctor. I mean, that's the question. David, what do you think?
Yeah, no, I absolutely echo that. I mean, we are terribly socialized in medical practice. When Andy was saying all the things he didn't get taught about in medical school, I never went to a lecture at all in medical school about what causes health. No, absolutely no. I must have gone to 5 lectures on what causes multifocal leukoencephalopathy, but never about what causes health. So this issue, and it comes back to your initial question, Fee, about one of the things everyone gets confused, and we in the health profession gets confused. We talk about healthcare and health interchangeably, and they're chalk and cheese. They really are. I mean, I think the latest evidence is that healthcare, although incredibly important icing on the cake, is about 10% of the determinants of overall health. I mean, I think we probably all like to vastly overestimate the role of healthcare in health. And you asked what a vision was for the healthcare system. Well, one of my visions is to have the Secretary of State stand up in Parliament and say, good news. This year we've needed to spend less on the healthcare system than we did last year. Not that we've done more hip replacements, not that we've seen more people. I know there's a lot of unmet demand out there, but the long-term vision has to be the smaller, smarter, leaner healthcare system. It's essentially a rescue system. We spend 10% of our GDP on it. If you spent 10% of your cycling budget on bicycle repair kits, you would know you were doing something wrong. So the idea that we should spend more and more and more on healthcare is not a good thing. It's an indictment of the system and of course we're incentivized. We are within the system. We are within the bubble that says healthcare is a universal good thing. The more we have, the better everything will be. And actually we know that's wrong, but we're not very good at reframing that to say that healthcare is an incredibly important part, but as Andy and Robin and others have said, the antecedents of health, the causes of health, what makes a health creating society are something that we as health professionals, even though we work all our time within the healthcare system, should add voice to, hugely add voice to, and be humble and say, we're here to pick up the pieces essentially. The real health is made out there. And that's exactly what that book you showed says, Fee. That phrase, healthcare is made at home, is actually an African saying. You know, healthcare is made at home and hospitals are for repairs. That's an African saying. Yeah.
Did I see you reaching for a book, David, from what looked like wallpaper,
Yes.
but it's in fact bookshelves?
I wanted to get competitive with Andy and show, but so this is Drawdown by Paul Hawkins, and this is a wonderful book. And I wanted to say it was a wonderful book because it doesn't have a chapter on health in it. There's no chapter on health. It's not siloed in one corner. Health runs throughout by stealthy means throughout every one of these 100+ interventions, which are highly evidence-based, Chantelle, you'd be pleased to know. They're working now, and if they were done at scale and pace, there's every bit of evidence that it would be one of the ways out of the catastrophic journey we're on at the moment. And I think it's very important, coming back to Vishal's earlier point about we need to be pathologically positive, but realistically positive, microseconds after we've alerted people to the nightmare we're facing into. Otherwise, we'll all clamp down into denialism and disavowalism.
Fantastic. There's a reading list coming out of this.
One of the things I think
go
to Ed Chivian, I think Shivali ought to put on the website where Ed Chivian's essay in 2014 in the British Medical Journal, which was a lovely encapsulation of the clinical analogy of treating someone early with meningitis to treating the planet before it gets so out of control that any actions will be way too late. So the precautionary principle that we on this call are all very familiar with is something pretty alien to many, many political systems in the world for complex reasons. But that's a wonderful essay in 2014 that Ed Chivian, I think you asked him to write it in the BMJ, and it's a very often cited piece of work.
Thanks, David. Shivali, give us some questions from people.
Sure. We have a specific question from Jalini Joa here to Chantelle. Can we quantify the carbon cost of an average operation?
Yeah,
Chantelle.
so we can always consider estimating carbon. There's always going to be errors, and those are in relation to the boundaries that we set, as well as the methods that we're using, and we sort of call that the truncation error, and really that's up to around sort of 50. It's been quite as high as 80% in terms of the actual inaccuracies associated with the carbon footprint that we do. So yes, it's possible to do a carbon footprint, but I would argue that its main use and the only real time that we should be using those methods is when you're making a direct comparison. So when you're trying to find hotspots, or when you're trying to actually compare to alternative products. So if you're using the same carbon footprinting method, then you can use that to see which is the environmentally preferable option, but the goal shouldn't be to actually quantify this is actually an operation that produces 100 kilograms of carbon dioxide equivalents. The goal should be, where are the hotspots, where can we make the reductions or is this single-use surgical piece of equipment actually better or worse, and get a sense of the scale of the magnitude when compared to the reusable alternative.
Thanks, Chantelle. Another question.
Sure. We've got a number of questions asking on specific things doctors should be doing and where should we focus our efforts on a practical level.
Vishal, where should doctors be focusing their efforts on a practical level?
Yeah, it's a difficult one because you probably need a balance of my passion and these guys is kind of rooting in the behavioural science and some of the practical campaigns, because like I said, I think people need to take a much more radical approach and really think about what the environmental breakdown really means. If you take an internationalist approach and if you really believe that all lives are equal internationally, including marginalised groups within this country and for future generations, then I think you should really consider your full-time practice and move into other forms of community building. It's like our leadership needs to move into different territories. So I think, yeah, I don't have, if you want to take the plunge with me, then you can get in touch. But if you want more practical solutions for what you can do whilst keeping your job, then maybe pass the question on to someone else.
Terry, you put up something to, thanks, Michelle.
Well, so I think this comes out in reverse on here, but
no, that's right.
Okay. So, RCGP, the Green Impact for Health Toolkit. This is a scheme which started with the National Union of Students some years ago, but now they've spun it off into their charity SOS. And any healthcare organisation can liaise with SOS and set up their own particular toolkit, which and it solves exactly that problem. If somebody asks, what can I do? It tells you what you can do, and there are various gradations. So, for instance, there's bronze, dead easy, silver a bit harder, gold a bit harder, and now we've got a carbon one, which is going to be a pathway to net zero carbon by 2030. And it really is hard when you're working, when you've got your head down, to work out what you need to be doing. You can't be doing all the research yourself, and there's so many things you should be doing. So we have to make it easy for people. This is, you do A, you do B, you do C, you do D, and it makes it easy. Putting out your recycling bins is easy, okay? If you had to go and buy a different bin every week and it was a different size and things like that, it would be difficult. But putting out your recycling bins is easy. And so we have to make things easy for people. Putting on a seatbelt is easy. We have to make things easy for people, and then they'll do it.
Thank you very much indeed. Shivali, another question.
So moving from doctors to hospital trusts, what examples of quick wins can a trust support to galvanise staff passion to contribute to the sustainability agenda, and what is needed to make these wins happen?
David, this is something you've I can't think, I was going to say struggled with, succeeded in, I'm sure, in your role at the SDU.
That's good, thank you. Yeah, there's a brain, but I mean, I think one of the things that a hospital trust can do is allow their staff to speak out. That's very, very important. Many people who work in the sustainability area do it under the radar, but actually, take Newcastle as a good example. They've declared a climate emergency. I think both the Acute Trust and the Mental Healthcare Trust in Newcastle have both declared a climate emergency. Now, you can debate what that means till the cows come home. The important thing it does is legitimize action. So that's a sort of leadership. It can legitimize action. The second thing a trust can do is to report on their progress. Even if there is none, and even if it's woeful, they still have a big area in their annual report where they report on it and ideally measure it, not as a sort of last paragraph that says we have meat-free Mondays, but right up next to financial accounting. If you look at the most innovative organizations in the world, they put in, I think Andy mentioned triple bottom line, but you put your financial accounting next to your social accounting, next to your health accounting, in terms of your health outcomes of your trust, your finance, and your environmental and you put them, you you hold yourselves to account for them. Now, one of the important things about doing that is that it gives the regulatory agencies nationally the confidence to embed that for everybody. Because if only 1% of hospitals are doing it, it's homeopathic. What the important thing is to make it, to give the regulators and politicians confidence that there's something we can legislate on, because people are already doing it. Standards are being set, metrics are being devised. So empower your staff, because your staff do everything, and regulate and hold yourselves to account in comparable ways that can get embedded in regional and national and hopefully global legislation.
Coming to the close in a little while, just a couple of final comments if I might ask from Andy and Robin. Vishal mentioned leadership. David, you've just mentioned leadership. Where has the leadership to date gone wrong with this? Has it been adequate? What needs to change? Future generations of leaders, where are they? How can we empower them? Andy?
Well, I think we haven't had the leadership perhaps that we should have done in terms of the profession, partly because we've all been brought up in a very siloed way of thinking, a very narrow conceptualization of health and medicine. And I think we're now beginning to see that it's much wider than the kind of exclusive focus on healthcare delivery, important though that is. I think with leadership, you also have to have humility, and you have to have listening to people is really crucially important. And I think maybe in medicine, sometimes we're not very good at listening. We're often very good at telling people what to do, necessarily without necessarily having listened to what their priorities and concerns are. And increasingly, I'm quite taken with this whole idea of co-designing solutions. And that might be co-designing with patients in the clinical sphere, but also co-designing with other stakeholders. You know, for example, how do we design healthy cities? We need to work with people who are at the leadership level in cities, as well as those people who have to implement change. So I don't think leadership is necessarily about telling people what to do. In fact, it isn't often telling people what to do. It's listening to people's conceptions about what they think is the way forward, what their priorities are, and then trying to integrate that into a broader framework of health and sustainability. And in doing that, I think we need to avoid, as I've said before, the kind of arrogance that comes sometimes from the medical profession, thinking that it is the dominant profession. And if we really want to make a change, then we actually have to see that we're part of the kind of health, the kind of panoply, if you like, of health generating organizations and entities in society, but we're not the only one. And as Nigel Crispus said, you know, we're very much at one end of the spectrum. Do I see an optimistic change? Yes, I do, because I think there's a lot of fantastic people coming up now who've got a much broader vision. And I think we're now working with a whole range of different disciplines that we probably didn't talk to, certainly in the research domain, a few years ago. And so we're creating a whole new model of kind of leadership, thought leadership, which is much more distributed. It's much more respectful of different perspectives, I hope. It embraces a whole range of different sectoral insights. And I think it's much more robust, resilient, and flexible than the kind of previous rather narrow vision of leadership that we had before, hopefully, anyway. So I think we're definitely on the cusp of a change. Whether we can scale that up, I don't know, but I think there's a great appetite for it from people who are coming up now, the next generation of leaders.
Thank you very much, Andy. Robin, has leadership failed? Where is the next generation of leaders going to get its strength from?
Well, we've clearly failed in the sense that although we've been at this for 30 years, we haven't made the impact we'd wish to have made. I don't think that's in doubt. I agree with what Andy said. There's one element which I'd like to add, which is I think that we've been far too slow in incorporating young people into leadership roles. And I think that there's an essential element in us. You know, I look at us now, I mean, happily there are a few young people on this particular panel, but so often there are no young people. And I think we have to find a way in health professionals of incorporating not only the range of people that Andy was talking about, but a younger group of people. And the third thing we have to do is to tap into the wisdom of communities. And we've already talked about citizens panels. I think we should be promoting citizens panels throughout the health system and much more widely. So we do tap into that particular wealth of experience. We also tap into the energy and the insights of youth and build on the kind of new shifts which Andy was talking about. It is worrying to think, as you get older, as some of us are, that we have so lamentably failed to actually disseminate the obvious truths which we've been aware of for 30 years, and finding a way of doing that to a much wider constituency along the lines that Andy has said. But I also think in terms of involving younger and more perhaps energetic people is essential.
Robin, thank you so much. I'm going to bring this to a close now. It's been a very, very fascinating and wide-ranging discussion. Thank you so much. Just in an attempt to pull the strands together, we began talking about COVID and the amazing, extraordinary, unexpected speed with which society changed in response to COVID, and the actions that politicians and others felt able to take in response to this pandemic. And perhaps showing us that the speed at which we're responding to this much greater emergency of climate change really is wholly inadequate, and we need to take that forward at a much greater pace. And we need to communicate the fact that while COVID is a very frightening thing, this is, as Vishal said, not the thing we're worried about. We're worried about this other thing, environmental and societal breakdown. And to try to communicate that terror, if that's the right word, that many of us feel, into something that is actually action-oriented rather than paralysing. And that action might take place at the community level. Increasingly looking at the COVID response, there was that community response. Can we learn from that? Into the political sphere, can we empower our politicians to respond? Many of them would like to, but may themselves feel unable to act. Through activism, making it okay for doctors in particular to show their activism, and also to normalise that and to help them to understand that health is the thing we're after, not healthcare. And then even within traditional medical roles, while acting in the clinical sphere, to take evidence-based action and help to bring people along with us, patients and colleagues. And then really to get hold of data and use that data to educate ourselves and to educate the next generation of people in the front line, but also people who can become the next generation of leaders who need empowerment and encouragement and support. That is my very brief summary of what we've discussed. It's been a very, very good conversation. Thank you so much to the panel. Thank you so much to those of you who've been listening. I hope you'll continue the discussion. The reading list will be circulated somehow or other. Do comment on bmj.com or also on the FMLM website. And I'm going to hand back now to Shivali and Laura.
Thank you so much, Fiona. Thank you again to our panel for sharing your expertise and your reading list with us. And thank you again, Fiona, for chairing this evening. Of course, the event couldn't have been a success without our audience, so thank you to all of you. I apologise if we didn't get to your question, but it's so great to see the enthusiasm and wonderful to see the discussion that we've generated. It's clear that we've got huge challenges ahead, but we have seen there's a lot that we can do, and it'll be all of us that will be required to make those changes. I hope it was educational and provided an insight into how we can start implementing these changes in our workplaces and organisations. We're also very conscious that this doesn't remain a standalone event, but rather a platform from which we can connect with other individuals who want to make these important changes. One organisation that provides courses in this area is the Centre for Sustainable Healthcare, and I strongly recommend visiting their website for more information about this.
Other ways doctors can get involved. So Doctors for XR and Healthcare Declares Emergency have plenty of plans for both virtual and in-person activism. You can find out about the affinity support groups and other information regarding planning for upcoming events on their websites. If you want more information about anything you've heard tonight, feel free to contact us or the FMLM. This event is also recorded, so it will be sent out in the next few days, and please do share it with any other interested colleagues or friends. We'll also try and compile a list of the books that we've discussed earlier and get them sent to you as well. Thank you once again from Shivali and I. Have a good rest of your evening and good night.
Bye-bye.